The Council of Governors is now faulting the national government on its push to send trained nurses out of the country, insisting that the policy must be rescinded and rethought. According to the CoG, county-run hospitals are in dire need of a skilled workforce. The Ministry of Health has, however, allayed those fears, saying there are enough health workers for both domestic and the international markets. NTV's Brian Mushiri has a lowdown for us.
The Council of Governors has called for a rethink of the policy of sending healthcare officers outside the country in the spirit of securing jobs. According to the Council of Governors, it is a paradox that healthcare workers are being sent out of the country to seek greener pastures, yet the situation in the country is wanting.
Currently, the Kenyan public sector has a health worker crisis with only 14 health workers per 10,000 Kenyans. That ratio is something that I think is not duplicated in Western countries, but I believe it's a common scene in almost all of Africa.
Speaking at an international workshop on developing a healthcare workforce for Africa, organized jointly with the University of Nairobi's Institute for Development Studies and the King's College of London, Governor Muthomi Njoke said county hospitals are suffering due to budgetary constraints, yet there is room for both levels of government to sit and agree on a framework to better equip the healthcare system.
Why is it that we have very many nurses who have been trained coming out of the nursing and medical colleges, yet we have shortages in our facilities? It is a question of affordability, it is a question of funding to health.
But in a quick rejoinder, the Ministry of Health said there is enough workforce in the country to work for the national government, counties, and to send abroad. The ministry says there is no cause for alarm.
They are saying we must produce fit for purpose. Don't just produce. Sometimes in our space of regulation, we find that, like I'll give an example just from medical school, CF is here. They are producing 1,000 doctors now. 5 years ago, they were producing 300. So we wonder if those 1,000 are able to fit in those internship centers, the training centers, and getting exactly what they require to come out.
CoG is also alarmed by the high number of doctors seeking scholarships from the national government, leaving counties in a state of limbo. As it stands, counties are paying for doctors on study leave without a replacement. A report by the Council of Governors for 20 counties shows that 362 doctors are away on study leave, while 135 have completed their scholarships and are expected back in the counties. 229 doctors are still out on postgraduate training. Brian Mushiri, NTV.